My name is Amina Yusuf Jega from the Department of Pharmaceutical and Medicinal Chemistry in Usmanu Danfodiyo University, Sokoto. On behalf of the authors, I present a research work titled Effect of Ochna Kibbiensis Leaves on Plasmodium berghei. By way of introduction, Ochna Kibbiensis belongs to the Ochnaceae family. It is a small tree or shrub found in tropical Africa, mainly from Guinea to southern and northern part of Nigeria. And some of the ethnomedicinal uses of the plant includes its use in the treatment of malaria, management of pain, inflammation, among others. So far, pharmacological actions that were conducted include antimicrobial and anti-proliferative studies on the leaves of the plant. And phytochemically, ocnaflavin remained the only major phytochemical constituent that was isolated so far from the plant. From my left is the picture of Ochna kibbiensis in its natural habitat, and then the chemical structure of the only compound that was isolated from the leaves of the plant. Now, the statement of research problem. As we all know, malaria is a major public health problem which affects not less than 40% of the world's population. An estimated 1.2 billion people are at high risk of transmission, more than half of which live in the African regions, and Nigeria alone accounts for a quarter of all malaria cases in Africa. African regions account for 81% and 91% of the world cases and deaths, respectively, with 86% of the mortalities observed among the under 5, that is, children under the age of 5. The disease poses severe impediment to social and economic development through a variety of ways, including school and work absenteeism, high treatment expenses, and decreased productivity in farming. About 70% of Nigerians are poor and majority live in rural areas. The dire economic situation in the country and many other underdeveloped countries necessarily means that the majority of the populace cannot afford the current gold standard treatments, that is the artemisinin-based combination therapy, if they are available at all, because in some places the drugs are not even available for the populace to purchase them. Now, it is important to note that these drugs are also compromised by resistance to the parasite. And this study was justified based on the fact that malaria affects the world's poorest countries and largely offers an attractive market for international pharmaceutical investors. And the plant has been utilized in traditional medicine to treat malaria. The aim of the study was to evaluate the effect of the methanol leaf extracts of Ochna kibbiensis and its N-hexane, dichloromethane, ethyl acetate, and N-butanol soluble fractions against Plasmodium berghei. The work was achieved through the implementation of the following series of major activities. Firstly, the median lethal dose of the extract and its fractions was determined according to Locke's method, and then the antimalarial activity of the extract and the fractions was evaluated according to the method described by Riley and Peters, suppressive, curative, and prophylactic tests using chloroquine-sensitive Plasmodium berghei. The research hypothesis states that the leaves of Ochna kibbiensis has antimalarial activity. The results obtained for this study was expressed as mean standard error of mean. Statistical analysis of control and test data was based on simple one-way ANOVA, and Donet's post-hoc test was used for different doses within a group. Benferroni post-hoc test was used to compare results between the means at significance level considered at p-value less than 0.05. The whole plant material was collected from Samaru, Zaria, northern Nigeria in the month of December 2020. It was identified and authenticated by Malam Namadi Sanusi of the Herbarium Section, Department of Biological Sciences, Ahmadu Bello University, Zaria, where a voucher specimen number 573 was deposited for future reference. The plant materials was shade dried and pulverized using mortar and pestle to obtain the powdered sample, which was subjected to extraction using maceration method to obtain crude methanol leaf extract. The extract was later partitioned using solvent of increasing polarity, including hexane dichloromethane, ethyl acetate, and M-butanol to obtain all the fractions, which were later subjected to acute toxicity test using Lux method. And then all the fractions and extract were subjected to antimalarial assay according to the method described by Riley and Peters' suppressive, curative, and prophylactic tests against chloroquine-sensitive Plasmodium berghei. The result of the extraction and fractionation yield of the plant is indicated in Table 1. The methanol extract and M-butanol fraction have higher yield compared to the other fractions, which is an indication that the plant contains majorly polar constituents. While the acute toxicity studies of the extract and fractions of Ochna Kibbiensis is presented in Table 2. All the extract and fractions exhibited an LD50 value greater than 5,000 mg per kg, which is an indication that the plant is relatively safe for consumption, with the exception of M-butanol, which had a slightly lower LD50, which indicates a slight toxicity. The methanol leaf extract of Ochna Kibbiensis and its fractions exhibited significant chemoseparation of parasitemia, which was found to be in a dose-dependent manner. The most active fraction was found to be M-butanol fraction, which had higher percentage chemosuppression at the medium dose, which is 250 mg per kg, compared to the chloroquine at 5 mg per kg, which had 94% chemosuppression of parasitemia. And the least active fraction was found to be the methanol extract, which had lower percentage chemosuppression compared to the other fractions. The methanol extract and its fractions exhibited similar effects that was observed in the suppressive test. The M-butanol fraction was found to be the most active fraction, which exhibited percentage cure in a dose-dependent manner, and the least dose, which is 125 mg per kg, exhibited a higher percentage cure compared to the standard drug, which is chloroquine at 5 mg per kg, which had lower effect compared to that particular dose. Now, the least active fraction was found to be N-hexane fraction, which exhibited a lower percentage cure compared to the other fractions. The prophylactic effect of the extracts and fractions of Ochna Kibbiensis was also similar. The effect was in a dose-dependent manner and statistically significant, with the most active fraction being the dichloromethane fraction, which had 100% prophylaxis at the lowest dose employed in this study, while the least active fraction was M-butanol fraction at the tested doses. Based on the findings of this study, it can be concluded that the leaves of the plant Ochna Kibbiensis was found to be relatively safe based on the LD50 values obtained, and the plant have demonstrated significant antimalarial activity with suppressive, curative, and prophylactic effects. In addition, it is important to note that isolation and characterization of the bioactive constituents responsible for the observed effects is still ongoing in our laboratory. Thank you. These are some of my references. Thank you for listening. We wish to acknowledge the efforts of Malam Hamza Muhammad and Mr. Yusuf Sani from the same institution, Usmanu Danfodiyo University, Sokoto, here in Nigeria. And the support and funding of Tertiary Education Trust Fund, that fund is gratefully acknowledged for supporting this research.